And lastly, then is there any part of marijuana that is healthful, beneficial, medically important? And the answer is yes also. Now, this is where people get confused. How can something be both bad if you're smoking it and good? Because, well, there are medical properties in it, lots of them. And these medical properties have been able to be one of the best single treatments for brain tumors, glioblastomas, for seizure disorders, and for other conditions in the body. So we have an enormous amount of good that can come from the medical applications of the cannabinoids and the other nutrients that are within marijuana, as well as rejuvenated an entire industry of hemp. There was a time when hemp was legal. The rope of hemp was stronger than any other type of rope. And hemp protein, hemp essential oils. So you could then take large areas that are now growing, let's say, soybeans genetically, and you could convert those into hundreds of items grown with hemp. It would be an enormous benefit to society. The latest study to support this is molecular pharmacology. And this is where they found a compound. We already know that it helps with rare muscular diseases, arthritis, seizures, and cancer. But there's a chemical in the cannabinoid family that impacts Alzheimer's. This was a study published in the Journal of Molecular Pharmacology. It's home because a lot of people in America are now suffering from Alzheimer's, and I predict that in the next 10 years, you will have more Americans suffering from memory loss, dementia, Alzheimer's, Parkinson's, and ALS than you will cancer. That's how bad it's going to be. And we have not prepared for this at all. So what it does is this. The study found that a compound within cannabis harnesses two therapeutic properties ideal for addressing both the surface symptoms, meaning memory problems, and the root cause, brain plaque of Alzheimer's. It states very clearly that the compounds which normally account for the high, the delta 9, THC, competitively inhibit the enzyme acetylcholinesterase, as well as prevents this induced amyloid beta peptide aggregation, meaning the actual laying down of the plaque in the brain. And that's a key pathological marker of Alzheimer's disease. You look for the amyloid plaque. Here's what the study abstract says, quote, compared to currently approved drugs prescribed for the treatment of Alzheimer's disease, THC is a considerably superior inhibitor of A-beta aggregation, and this study provides a previously unrecognized molecular mechanism through which cannabinoid molecules may directly impact the progression of this debilitating disease, end quote. That's very positive. And again, I believe that in the upcoming years, we're going to find hundreds and hundreds of uses that would be beneficial. Now, for those of you who are still eating genetically modified soybeans, think about this. According to a late report, consuming genetically modified soybeans could be serious because of a transfer mutated DNA to milk and decreased birth weights of newborns. And so, for example, the dangers of genetically modified soybeans have been in our consciousness for some time now. But once you consume the genetically modified soybean, it can transfer in the body. It cannot be predicted what the outcome will be, and now they're starting to find all these bad outcomes, including in the milk that is given to the baby. One single nutrient is called out because it can outperform vaccines. This is from Natural Health. And it also ties in with yesterday's discussion on vitamin C and how goats can produce 100,000 milligrams a day, and they're the healthiest of all the farm animals, and how gorillas produce about 5,000 milligrams. So how much should we produce? If you're athletic, if you're exercising, if you're sick, if you have cancer, if you have any immune-related disease, you're going to need a lot more. And I mean a great deal more. In fact, what we found when we were working with people with full-blown AIDS and who were dying, that you couldn't even get vitamin C measured in the urine. The body was using it until you got them up over 50,000 milligrams, 50 grams a day. And the more you gave over, let's say, a year and a half period of time, the more the body rebalanced itself. Until time, 11 of the people who were on the very extensive protocol, meaning they were there 5 days a week, 4 hours a day, free treatment, by the way, they reversed all AIDS-defining illnesses. There wasn't they even tested HIV negative at the end, though they had been HIV positive before and they reversed. Every single disease they had, AIDS-defining illness, was gone and stayed gone. And we brought these people to a press conference. They were on PBS with their medical records and their doctors, and not a single thing was done about it. No one cared because it went against the drugs, the pharmaceutical approach. It went against the money machine, and the money machine won, except for these people who are alive. And the people who are being treated with the money machine died. So vitamin C was one part, but a very important part. Here's the latest on this. Quote, Dr. Frederick Klenner's findings of vitamin C and its incredible ability on everything from polio to multiple sclerosis to reactions from venomous snake bites can be found in the papers and other writings he authored across the span of 30 years. His documented success stories fly in the face of conventional medicine, which calls for risky, invasive medical treatments like the measles, mumps, and rubella vaccine. Based on Dr. Klenner's years of study, it appears vitamin C acts as an anti-infective agent and reducing agent, as well as an anti-clotting agent and oxidizing agent and an antihistamine. Let's take a look at some of the benefits of vitamin C in Dr. Klenner's years of medical research. Are you looking for real solutions for infectious disease, cancer and cardiovascular disease, hormone imbalances, and heavy metal toxicity? And here's what the oncologists, the naturopaths in the world were beginning to become aware of. That Klenner did a lot of studies, and he had great results, but he couldn't get any media. The media was afraid to have him on to talk about what he was doing. I had him on, and he always had papers, and he always had patients, and he always had good charts. He wasn't a quack. He was a futurist. He was way ahead of this curve. Polio, quote, polio was reversed with vitamin C therapy. While others before him had theorized that vitamin C could play a role in lessening the effects of polio, it was Dr. Klenner who first gave polio patients doses equivalent to tens of thousands of milligrams of vitamin C every day. While Klenner had presented briefing of his findings on vitamin C and polio back in 1949 at the annual sessions of the American Medical Association, babies, children, and adults continued to be crippled or killed by the virus as others in the medical field gave his findings little notice. Klenner recommended giving the vitamin C dosage intravenously, but noted that the intramuscular route could also be satisfactory. By the way, I would disagree with that completely. He administered at least 350 milligrams per kilogram of body weight, a dosage equal to about 30,000 milligrams for an adult. According to Dr. Klenner, massive ascorbate treatment cured every disease of 60 polio patients under his care. None had paralysis, and all were well after beginning 3 treatments, and by the end they were completely well. Dr. Klenner reported his findings, this time in the Southern Medical Medicine and Surgery Journal. Great journal, by the way. Again, few in the medical community took notice. Then you have boost immune function and eliminate disease symptoms naturally. And there were ways of helping with everything from shingles. An example, to quote, Dr. Klenner's success with the use of vitamin C to combat a number of infectious and toxic invaders is astonishing, including his published work with 8 patients with shingles. Each person was given 3,000 milligrams of vitamin C every 12 hours, and 7 of the 8 patients reported complete relief of pain associated with shingles within 2 hours of receiving the vitamin C. Overall, the patients received from 5 to 7 injections of vitamin C. Blisters associated with the shingles virus began healing quickly and were completely gone for the first 72 hours. Dr. Klenner's observations are supported by findings of other researchers as well, both before and after he had published his work. An earlier study reported success with 14 shingles patients receiving vitamin C injections. In a 1950 report, shingles completely disappeared in an astonishing 327 out of 327 patients just 72 hours after they had received vitamin C injections. Dr. Klenner's work did not stop with shingles or polio. A long list of illnesses, including pneumonia, hepatitis, measles, mumps, diphtheria, and the flu, were cured with use of vitamin C therapy. The key to vitamin C's effectiveness is the practice of giving enough for a long enough period of time. And while some chronic viral conditions may not resolve promptly, researchers yet to identify an acute viral condition that vitamin C cannot eradicate, other than in patients with severe tissue damage and near death. For example, in pneumonia, patients, Klenner recommended at least 1,000 milligrams of vitamin C intravenous every 6 hours for mild cases and higher for serious cases. And also with hepatitis patients, patients were able to resume normal activities in just 2 to 4 days after receiving about 30,000 milligrams of vitamin C. So just some additional research from a remarkable pioneer who is completely unknown today, who published a lot of work. He was an orthodox doctor by all other measures, except when it came to being the first physician outside of Albert Szent-Györgyi, who I also interviewed, who won the Nobel Prize for discovering vitamin C, ascorbic acid. But he didn't use it at high doses. It was Klenner who first used it at high doses, and that's in the 1940s and 50s. So just a look back, because it should be used today. It could be helping a lot of people. That's the latest on health and healing.